Hello folks, Russ Scala here at Vicki ILiff. How's everybody doing today? Our topic today is going to be on breast implants and some of the recent information that women can think about when they're having issues. I think this is going to be a hot topic, Vic.
Yeah, I mean, it's widespread. How many did you say get them yearly, just in the United States?
Yeah, we have about 300,000 people in the United States that get breast implants every year, and about 5 to 10 million worldwide. So it's a pretty large number.
Mm-hmm. Yeah.
What I wanted to do, folks, was a little backstory. When I started working with plastic surgeons in 2005, 2006, we were developing advanced amino acid and treatment protocols to help speed wound healing. And what happened as I immersed myself into the plastic surgeon's patient's recovery,
Mm-hmm.
we found out that if we increased protein, did mitochondrial testing, that the people after surgery, they would heal faster.
Right.
But what we also found out was a good portion of the women that had breast implants had problems, had issues, not just with the insertion of the silicone or the saline breast implants, but they had metabolic issues that I didn't really understand back then because of we didn't have this advanced testing and knowledge that we have now. But this gets back to, Vic, every woman being biochemically unique.
Mm-hmm.
And if you're, ladies, if your immune system is already compromised when you have breast implants, this can open up the door to light up your immune surveillance like a Christmas tree. And what we have found out since 2004 in researching this, and I continue to research this today, and we educate plastic surgeons on what could happen when women have autoimmune diseases, what happens when people have a very have immune system that's gone awry.
Mm-hmm.
We treat everybody multifactorially, but in a lot of cases, this has pointed back to the breast implants that are causing this elevation in pro-inflammatory cytokines.
You were saying that the half-life is around 7 to 10 years?
Yeah, basically, folks, depending on the implant, the average is about 7 to 10 years. And a lot of this information, I'm not sure if the plastic surgeons go over this or women are just wanting to get the breast implants and get on with life, and they think it's completely safe.
Mm-hmm.
Well, a lot of women that get breast implants, some of them, Vic, have an inborn error in metabolism, or they may have subclinical hypothyroidism, or their immune system may already be compromised from the standard American diet.
Mm-hmm.
And then when they get the breast implant, that's the straw that breaks the camel's back and really lights up their immune system. And it's interesting, folks. I've had runners that were compromising their immune system with overtraining,
Mm-hmm.
and then they've had implants, and once they've had the implants removed, their inflammation markers came down. We've been tracking this throughout the years. Now, it's not everybody. I'm not saying everybody that has breast implants is going to have an issue, but if you have an undiagnosed pathology or an autoimmune disease, and we have to look at removing the body burden, a lot of it points to having the breast implants removed. And we've had a number of people I've worked with face-to-face, tested them before and after the breast implants were removed. And I'm getting a lot of feedback from the plastic surgeons that do breast augmentation.
You were talking about relief, helping with the body burden, and the liver has a lot to do with that. Through the research and everything, the shells on whether it's silicone or saline are the same, and then they start to degrade. And there's actually there's lead, cadmium, mercury. Those are in the shell. So as that, like, the half-life comes up and those degrade further and further, those can be released into the system and cause widespread issues. And people may be more sensitive than others depending on the current state of their body.
No, that's good. And the women that have had issues with breast implants, again, folks, there's never going to be one diet, one pill, one treatment protocol.
Mm-hmm.
When we pull together a high-level intervention and the woman has breast implants, we look at multiple metabolic markers, because we know throughout history that I think breast implants first started back in World War II when Japanese prostitutes were injecting silicone to make their breasts larger to attract more of the soldiers. And then from there,
Oh, okay, I didn't know that.
From there it moved to Vegas, where the topless dancers were, and then I think in the 1960s and 70s it sort of went worldwide when the doc first breast implant. So again, it's medicine. Medicine is always evolving.
Mm-hmm.
But understand, when you put something foreign in your body, as Vic said, that can outgas or can degrade heavy metals in your system, it's going to compromise multiple metabolic markers. Now, we've seen women with breast implants that have had neurological issues. Mm-hmm. It has been confused with MS. Right. They have intestinal tract dysbiosis, which we've tracked. Their intestinal flora gets out of balance. So here you may be inserting something for vanity's sake that may, you know, and again, they may be fine, but if you got to think about when you put something foreign in your body, folks, and then in your 20s or your 30s, when your immune system is really revved up, you're not going to feel anything. But as you age and you get hormonal imbalances, as your diet is still the standard American diet, the breast implants can be ground zero to open you up for a variety of autoimmune diseases, gut dysbiosis, and mitochondrial dysfunction because of what Vic just said, the heavy metals.
And it can increase IGF-1 levels.
Right.
Right.
Exactly. It's interesting that for some of the women that have breast implant issues, they start losing their hormones at 30. So when they start having breast implants issues at 40 and 45, what we developed is a program where we could test you, replace you nutritionally, hormonally, look at your mitochondrial levels, and then understand that the breast implants, if you're going to have them removed, we also have a program to support that and to rehab your body afterwards. So this is the information, folks, that if you happen to have breast implants issues and you have doctors that really don't know where to go, you know, with this, or we're available, you know, get a hold of us at Scala Precision Health, or you could reach out to us here and we could sort of put the data into your hands.
And there's I was looking up the full battery of tests that they've run on different cases, different women. There was one that she was 45 years old in the healthcare profession. She started having, like a cough, myalgia, fatigue, all of these different symptoms. And the test they ran on her was lengthy. I think it was about, 10 different tests, and they all came back pretty much normal until they gave her prednisone to suppress her immune system and ran further tests that improved things. And then they narrowed it down that they needed to come out. They took them out, and then she still maintained those same results even without the prednisone.
Yeah, and that's what I saw. I saw with the women endurance athletes, the women marathon runners that were compromising their metabolism with physical stress at a very high level. Women attorneys or women that have had implants that run their own business. These very high stress occupations, that they seem to be more susceptible to the problems that breast implants cause neurologically. Mm-hmm. If you have brain fog and you have fatigue and it's undiagnosed, it could be the breast implants that are causing this. And again, what we want you to do, folks, we want to save you a 2-year journey, a 3-year journey. A lot of our clients have been on a 3-year journey, and a lot of the women that I've met, Vic, that have had breast implants, they don't consider the implants an issue. Mm-hmm. They just think
they're considered safe unless there is a leakage. But even the valves can transmit bacteria. There's bacteria that can go from the actual, surgery itself, because no surgery is ever sterile. And then it can go into the valve, which can breed inside the actual implant itself.
That's interesting, and that's a good point. A lot of the young women right now that are in their 20s or younger that are getting breast implants, their immune system is functioning at a very high level. They may not feel any of these issues until later on, when physical, mental, or emotional stress may suppress their adrenal glands or their thyroid, or some women end up with low estrogen or progesterone levels, and then that's where the breast implants take the immune system and elevate it to a high level. And the blood work to look at is C-reactive protein. If your C-reactive protein is elevated, then it could be the breast implants that are causing that pro-inflammatory response. That
right.
Makes sense.
Right. Tina says that she thought she took the safe route with saline, but she was wrong. And I assumed the same thing until I did further research and found out that the shell is the same thing, whether it's saline or the silicone. The shell itself that you have in contact with your blood and tissues is the same. It's made of the same components.
Right. Right. Well, folks, one of the things I wanted to do with the plastic surgeons when I was working with the plastic surgeon was I wanted to develop an advanced hormonal nutritional testing program before the patient had surgery. That way we could correct the deficiencies before surgery, and that'll help speed wound healing. I've done this with many post-surgery patients. So the plastic surgery market, I thought would be a good fit for this. But, you know, obviously some of the docs, they're so busy making so much money, and I'm not shooting anybody down. It's just that they didn't plug it in. But this is why we want to educate you folks, because if you're having an issue, and you have to think about the environment. The environment is estrogenizing all of us. If you have breast implants and you have a high level of C-reactive protein elevated, you're suppressing your immune system. And what that does is open you up for a lot of opportunistic infections, autoimmune disease. People have been confused with MS, dysbiosis in the intestinal tract, and then people have fatigue and they have no hormonal deficiencies. Nobody knows where it's coming from. So hopefully this information, we're going to upload this series to the Russ Scala YouTube channel. So if you don't get it today, you'll be able to take this information and share it. Now, I don't want to put the fear of God into every woman that has breast implants, but I really want you to be aware. As you age, you have to understand these breast implants light up your immune surveillance like a Christmas tree, okay? And that opens you up for other opportunistic diseases that may take you 4 or 5 years to find out what it is, if that makes sense.
Exactly. You know, they say that the most common issue is capsular contracture, where, you know, there's scar tissue formed and they have to go in and fix it. You're also supposed to get an MRI yearly to make sure that they haven't moved or caused any issues. A lot of women don't do that. And you're also supposed to have them replaced every, I think, 8 years, roughly around that time. And some women don't do that. They think it's like a one-time and done situation, but that's not the case.
Yeah, I think, and again, we want to, you know, maybe the doctors can do a better job at educating somebody. When I was talking to the plastic surgeons, I know that when women get past 40 and 50, that if they have surgery, because their hormonal levels, their nutritional levels are already suppressed just from aging and physical, mental, and emotional stress, I know that when people go into surgery, they take a long time to recover. My idea is if you're going to have breast implants, do the nutritional and hormonal testing before you have the breast implants. Right. And then after you have the breast implants, wait 3 months and get tested again. This is the data that we're trying to share with everybody here on Facebook and on the Russ Scala YouTube channel, because, you know, when I've met these women and I've talked to them, and we have to get a lot of information and get a really good backstory. And the women with the implants that are older always seem to be compromised with brain fog, lack of energy. And because the breast implants are structurally sound, they don't think they have metabolic issues. Like they don't think the brain fog could be coming from the
cytokines.
Exactly. Yeah,
those inflammatory markers.
Yeah, and the plastic surgeons, they're not here to measure metabolic function. They're here to make sure that the surgery is performed well and that you're happy with it.
The healing goes well.
Right.
The drains are placed in properly, and nobody wants to hear, okay, it's your breast implants, you need to take them out. No one wants to hear that. But when, you know, I have a client that, you know, I've known for a very, very long time, and she was, you know, I was going over her history, over all the issues that she's had over the last 4 years. And it's funny how it all started after she had her implants put in. And I was gentle about bringing it up to her, and she's really not wanting to hear it. And she's on hormone replacement therapy right now because her testosterone's in the tank. She doesn't make enough estrogen either. Her progesterone is low. She has all these issues, and she's like, well, unless there's a test that can tell me that it's definitely the implants, then I'm not taking them out. And I was like, but that doesn't exist. You have to look at the whole picture. And then, you know, if you've addressed everything and you're still having problems, then that's going to be your last ditch effort to get those out.
No, that's a great example. And, you know, the bottom line is if you have implants put in, you got to understand that that's a foreign substance put in your body that's going to light up your immune system. If you do it when you're young, you're going to be healthy. If you keep the breast implants for a long period of time, everybody thinks as long as they look good, they're fine. But in reality, they could break down. There's heavy metals. Vicki and I have pulled together research for a couple of doctors here in town to help some patients that we have that show intestinal dysbiosis, an imbalance in the intestinal tract. It shows mitochondrial dysfunction. Those heavy metals that are outgassed from the saline capsule or silicone capsule can actually compromise liver function. So what I want to be able to do is if a woman is having this issue, we want them to be able to call us, and then we can do the advanced testing, and then we can even consult with your doctor. Because, you know, somebody asked me, does all the breast implants have to come out? I don't believe they do. I believe if we help women ramp up their progesterone, thyroid, adrenal function, I believe we could upregulate the immune system and where the breast implants can be stable. I mean, I'm not positive on that, but physiologically it
reduce inflammation through diet, lifestyle changes, things like that.
Right, exactly. And even the ketogenic diet, the reason I would use the ketogenic diet and the intermittent fasting with women that have breast implant issues is because on the cellular level, when your body switches to beta-hydroxybutyrate to burn, to make ATP, it creates less oxygen radical species, less free radicals. So if you switch from burning glucose, folks, to burning fat, then that's going to create less inflammation. Well, did I say less information?
Less information.
Okay, it's going to create less inflammation. Got a little tongue tied there.
Yeah,
so for a woman that had breast implants that is experiencing symptoms, we want to bring down those inflammatory markers. The ketogenic diet and intermittent fasting can bring down those inflammatory markers, the C-reactive protein. But also what I found out too, folks, is I got to be careful moving forward, is I like to correct the brain chemistry first, because a lot of women that have breast implants that are under stress, that run their own business, they're addicted to the carbohydrates because it elevates their serotonin levels and make them feel good. So and every woman is biochemically unique. This isn't going to happen to everybody, but just to put a shield up to avoid cancer, as we age, we want to keep our immune system firing on all cylinders.
And not fighting ourselves.
No, exactly. So what we can do moving forward, if there's if you have breast implants and you're experiencing brain fog, fatigue, that's undiagnosed, imbalances in your intestinal tract, these things can be fixed, and we want to be there for you to help you fix them.
Well, you mentioned the liver and detoxing. The testing that you do identifies the any lags in the detoxification pathways. So if there's any issues with them being able to clear properly, there's phase 1 and phase 2. If one gets backed up and you're not able to get rid of those adjuvants from the implants themselves, or if that's compromised already before you put them in, that's another area where some people can have slower onset of symptoms. So if you have a really healthy liver and your body's detoxifying really well, and you're not going to see symptoms right away, that they can come on later. And so sometimes people don't link it to the implants themselves. If someone goes in and gets the put in and their liver isn't detoxifying the way it's supposed to, you can have a faster onset of symptoms.
Yeah, and that's what I wanted to do. The plastic surgeons that we worked with, we consulted with folks, I wanted before the implants were in place or before a woman had any type of reconstructive surgery on her face, I wanted to correct all her deficiencies, because I've known from working with trauma victims in the past, whether it was brain injury, whether it was broken bones, compound fractures, anybody that's in surgery, when we ramp up their hormonal levels, the doctors look and understand that the person heals faster. So when you give the body what it needs, it heals faster. So
build those blocks.
Exactly. So with breast implants, again, you have multiple metabolic systems that can be compromised by having an elevated immune system. Your intestinal tract can be out of balance. You could have brain fog, and you go to your general practitioner, and he's not going to think about your breast causing this. So when we look at, like Vic said, we look at liver detoxification, we look at intestinal flora, we look at the brain chemistry, we look at the mitochondria, on how well the mitochondria is functioning. If you have breast implants, remember it can compromise multiple metabolic systems of your body that your doctor may not find. Understand that gut dysbiosis, brain fog, understand that nutritional and hormonal deficiencies, and even your mitochondria on a cellular level can be compromised from saline or silicone breast implants because of the heavy metals that are outcast from that material. So we want you to be able to ask the tough questions to your doctor. I've got more information on the Russ Scala YouTube channel about estrogen dominance, because if you have estrogen dominance and you're heavy and you have breast implants, that's the perfect storm for elevated estrogen and cell proliferation. If you're on a standard American diet and it's high in insulin and high in blood glucose, there you go, growth hormone. You've got, you know, oxidative stress from high blood sugar, and then you got cell proliferation from elevated estrogen. So anytime we could remove things from the body, we could remove things from the body and remove that body burden, be it implants or chemicals that we're rubbing on our skin, we're going to be a lot better off. So I hope that was informative. Share, folks, okay? I'm trying to get real content out there to you guys every week with the help of Vic, and we're doing the best we can. And I always appreciate you guys sharing what we're doing. Thanks so much, and thank you for being here, Vic.
Thank you.
You're welcome.